Can't hear you. I'm like, everything's perfect.
Yeah.
On News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, a 28-year-old woman facing murder in connection with the discovery of two young girls found dead, buried in suitcases earlier this week. Aaliyah Henderson is charged with counts of aggravated murder. She's the mother of the two girls. The Cuyahoga County Medical Examiner's Office identified the victims as 10-year-old Amore Wilson and 8-year-old Mila Chapman, both of Cleveland. DNA testing confirmed that the girls are half-sisters. The investigation is continuing while a community vigil was held for the girls last night. President Trump announced yesterday that Homeland Security Secretary Kristi Noem is out and that Oklahoma's Markwayne Mullen will take over the role effective at the end of the month. Trump posted the news on Truth Social, praising Noem for her work on the border while announcing she would move to a newly created role as special envoy for the Shield of Americas. There's now at least one less thing to worry about. NASA issued an all clear yesterday, announcing the asteroid 2024 YR4 now has zero chance of hitting the moon in 2032. In sports, high school basketball tournament action, girls game at 4:30 tomorrow afternoon on WHBCSports.com. It's a regional championship, Central Catholic taking on Smithville. Then tomorrow night on the radio, we'll have Alliance and Bedford Heights. I'm Pam Cook.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
The Medicine Center pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
Are you frustrated with the cost of prescription drugs? By now, you know that your insurance price isn't always the best price on your medication. The new Health Matters drug plan is a simple, easy way to save money at your local Medicine Center pharmacy. No need to visit GoodRx or Single Care, disclose your private information, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. It is that easy. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com.
Hi, Paul White for the Half Off and Out By store in Louisville, and we have brought back the discount ducks. Stop in and join the fun looking for rubber ducks throughout the store and save 15 to 30% off your entire purchase when you find a duck. So stop in and take advantage of these great deals at the Half Off and Not Buy store in Louisville, next to the Medicine Center Pharmacy. Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, midshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
Your severe weather station. News Talk 1480 WHBC.
Here's your AccuWeather forecast. Today will be warm with cloudy skies in the morning, transitioning to a mix of clouds and sun later on. There is a chance of a shower in the area during the afternoon with a high of 67. Tonight will be partly cloudy with a low of 60. Tomorrow will be cloudy, breezy, and warm with a few showers and a thunderstorm expected. The thunderstorms may bring localized damaging wind gusts with a high of 68. With the AccuWeather forecast, I'm meteorologist Jason Caterina for News Talk 1480 WHBC.
Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning we are talking with Dr. Lavery, and I'm sorry for the delay. How has minimally invasive surgery improved recovery?
Oh, huge. Patients who had surgery in the 90s or before that, they had a tube in their nose called an NG tube to drain the stomach contents for several days after surgery. Patients were essentially not given anything to eat for several days after surgery. Patients spent a week or longer in the hospital, which that in itself can cause other problems. Patients can develop blood clots from not moving around. But now, there's so many things that we do differently. I use the robot for most of my colon surgeries. And so the incisions are much smaller. Most of the incisions are about this big. And then there's another one that's about this big, about 4 centimeters that I do because I need a incision to remove the specimen from. But the incisions are so much smaller, and that helps with pain control. There's also the enhanced recovery protocol that we use in the colorectal world. And so that really does kind of help facilitate people passing gas and having bowel movements and returning back to their life sooner. So what that means is all of my patients will get a block, meaning anesthesia will numb up the abdominal wall muscles. And so that usually lasts for about a day or two. And that really helps with pain control. So patients are up and moving much faster because it doesn't hurt as more. So you're having better pain control, smaller incisions, which don't hurt as much. All of my patients are shocked when I tell them they can eat the day of surgery afterwards, of course, but they all get a regular diet after surgery. I expect them all to get up out of bed the day of surgery and start moving around. And my patients all go home about day 1, day 2 after surgery. As patients are shocked because they think that they just have to stay, but people do better at home. You know, the food's always better. You're used to, your own bed. Nobody really wants to kind of just lay around in a hospital bed for, days at a time. And so my criteria for going home is eating, urinating, walking, and pain's controlled because they will go home with pills. They won't get the IV stuff, obviously, at home. And then passing gas and having bowel movements, that usually happens day 2 or 3. So I always tell patients I don't necessarily wait for that to happen because that will just kind of naturally happen on its own. But robotic surgery has been huge. The visualization, I can see things so much better. I can get the camera to go so much lower in the pelvis. It can kind of reach around into smaller portions. And with the robot, it basically is like I'm using my own hands because I have wrist motion with the robot tool. And so it's basically as if I was doing this open without having this massive open incision. And so it's better for me as a surgeon. It's better for the patients. There's a special dye we can give at the time of surgery that can help me check blood flow, which I always do. So when I'm doing surgery and I'm putting things back together, I'm able to see which part of the colon has good blood flow. And that way I feel another tool where I can feel pretty confident that with the surgery I've done, the patient will have a good outcome because at least our blood flow is intact. So it's just been huge. And there's so many different things that we can do now versus before having the robot or stapling techniques. A lot of patients probably did end up with a colostomy just because it was way too hard to reach down low to be able to put people back together. So quality of life is just so much better for the patients.
Well, those robots are really busy, aren't they?
down there. My gosh, every physician we've interviewed on the on this show is way ahead of things with the robots. How many robots are down there? A dozen?
We have 5 in the system. So we
Well,
have 3 at the main hospital. We have 1 in Alliance and we have 1 in Orville. But the robot technology is huge. It's helped for so many different things. I know our urologists and our OB/GYN colleagues use them as well. I think our cardiothoracic surgeons use them for lung surgeries. We do gallbladders, hiatal hernia repairs. So when the stomach contents are going up into the chest, also all different types of hernias. So hernias in the groin, on the belly. My partners and I, we use them pretty frequently. So some days it can be really hard to just randomly add a case on last minute because it's been used.
when I
Wow.
when I first saw one at the Angel auction, I thought it was something out of a spaceship. I did not. They didn't explain right away that it was a that it was a robot for surgery.
It can make
Yeah,
patients a little nervous. Some
yeah.
of the older generation, they're a little nervous and apprehensive because they're like, well, is the robot doing it? And I'm like, no, the robot does not move unless I move my hands, but it's a great tool to have to be able to do surgery.
Jeez, that's very interesting.
So, what determines whether a patient gets a colonostomy
A
or
colostomy.
a colostomy? Excuse me. Yes.
So I'm glad you asked that because I have so many patients who come in and they do their own research. And I think we talked about previously why patients maybe don't want surgery or don't even want to address the problem. And I think it's because everyone's so deathly afraid of having a colostomy. But the colostomy is not my goal. So it's pretty rare if you come in electively for surgery. If you come into the hospital and you're having, difficulty having a bowel movement, bleeding, bowel's not prepped, we didn't do a bowel prep, then the colostomy is much higher when you come in through the hospital. But in the elective setting, when you come into my office and we discuss what's going on, I don't plan on giving patients colostomy. Yes, that's kind of my backup if things don't
Hmm.
go very well or I'm having a hard time getting things to reach. But on the right side, which is usually what patients are always afraid of, but on the right side, it almost never happens because right-sided colon cancer, you're connecting colon to small intestine, and small intestine has great blood flow and is very forgiving. And so on that side, you hardly ever have to give a patient an ostomy. And then on the left side, usually we're able to get things back together. We're able to kind of mobilize or detach things as needed to pull things down where we need to get a connection. And so I usually work really hard to try to get people back together. There are those chances where sometimes they don't, but for the most part, it's pretty rare. So, but yes, it can happen. And I think that also contributes to the fear that patients have because patients will tell me that they'd rather die than have that. And so then I think sometimes they just avoid getting evaluated and getting treatment because they just don't want that option to even be discussed.
All right. So, that comment kind of leads me into what we hear in the pharmacies, which I wanted to see if you could maybe just allay some fears, if you will. And, can you talk about some big misconceptions that you hear patients have about colonoscopies and the fear of getting them? Because I can't tell you, I'm sure you know, but I can't tell you how many people we've encouraged to stop avoiding the phone call to schedule their appointment because it's better to get your screening and find out what's going on right now than to put it off and find out in a year. It's not fixable.
Hmm.
I think some of it is the bowel prep. Unfortunately, people are just so afraid of that. It's really not that bad from talking to the patients that have done it, especially with the stew prep nowadays. There's not as much volume that you have to drink, and you're not. So there are some patients, depending on what prior history you have with constipation and things like that, who are up all night. But most patients aren't up all night. You do the bowel prep, you go to bed, you wake up once or twice in the middle of the night, you go, and then you have more liquid come out the morning of. But the bowel prep is really not that bad. I think some of it too is patients kind of know something's wrong, but it's that whole mental game of I just don't want to address it because I know something is wrong, and what's wrong is probably really bad. The patients who have had bleeding for months or years, and they're like, oh, it's just a hemorrhoid. I've always had this. Or all of a sudden, I'm having difficulty having a bowel movement, or I'm now going all the time and it's liquidy. And so you kind of know intuitively. I think everyone kind of knows that something's wrong, but sometimes it's hard for people to address that. I myself personally, I think part of it just because this is what I do all the time, I'm very aggressive in my own care where it's like if this is happening, I know I need to solve this because I know what the alternative is, and let's get ahead of it so we can fix it now versus waiting down the road. Well, now there's nothing that we can really do. And patients get frustrated with me, but I'm a little frustrated too for them because it's like you've had this for so long and you took so long to get evaluated. Now it's to the point where like I really can't help you. And maybe a few months ago I could have if we had addressed this. And so I get frustrated for them too.
It's time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you frustrated with the cost of prescription drugs? By now you know that your insurance price isn't always the best price on your medication. The new Health Matters Drug Savings Plan is simple, easy way to save money at your local Medicine Center pharmacy. No need to visit a website or disclose your private information, fumble with your smartphone, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com.
Hi, Paul White for the Half Off and Out By store in Louisville, and we have brought back the discount ducks. Stop in and join the fun looking for rubber ducks throughout the store and save 15 to 30% off your entire purchase when you find a duck. So stop in and take advantage of these great deals at the Half Off and Out By store in Louisville next to the Medicine Center Pharmacy.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
The Medicine Center pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
Have you ever gone to the pharmacy and decided not to fill a prescription because of the price? This is pharmacist Paul White. If you have skipped filling a prescription or a dose because of the price, we have great news for you. We are introducing a new membership program with wholesale pricing on every generic medication. Memberships are $5 a month. For many of our customers, our wholesale pricing is even less than their copay. Visit our website, medshoprx.com, and use our price checker to find out the price of your medication. Great deals at Medicine Center Pharmacy.
1480 WHBC.
Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show.
Doctor, can you recommend any lifestyle changes to reduce colon cancer risk?
Decreasing obesity is a huge one. Obesity causes chronic inflammation and can cause all kinds of different problems and medical conditions. Better control of diabetes and blood sugar control, decreasing overconsumption of sugar, processed foods, processed meats. It's unfortunate. My husband and I are actually talking about this today. It's so hard to try and figure out what to eat for breakfast because the American breakfast is bacon, ham, all the processed meats that we think about. And then lunch is usually lunch meat, bologna, turkey, ham, all those things, pepperoni, but really trying to decrease the consumption of those things as it's been shown to increase your risk of colon cancer. Increasing physical activity, smoking can increase colon cancer risks, overconsumption of alcohol. So all those things are modifiable risk factors. Increasing your fiber, so either dietary fiber or a fiber supplement such as Metamucil or Benner fiber that also has been shown to help decrease the risk.
Fiber is I continue to have challenges in getting enough fiber per day. So I feel like I eat pretty well and I exercise well, but man, sometimes fiber's hard. And I know that sounds kind of dumb, but I'm sure I'm not the only person that struggles with it. So, you know.
Fiber's hard. I have my patients who tell me they think that they're eating a lot of fiber. When I ask them what they're eating, they really aren't eating as much as they think. Lettuce, salads, those types of things don't necessarily have as much fiber as people think. I always tell people to read food labels. But avocado, raspberries, chia seeds, those types of things are pretty high quality fiber, and you really need more than you think. The recommendation for women is about 25 to 30 grams, and for men is actually 37.
Wow. Now you're really making me feel bad. Okay.
Mm.
So I was reading a Twitter post this morning about different things with fiber, and I had looked at some chia seeds at the grocery, and my wife made fun of me a little bit. But I'm like, between black beans and lentils and chia seeds and broccoli, I mean, how much broccoli can you really eat today,
Chia seeds
But
are good. Chia seeds are for I think 2 tablespoons, you get like 10 grams. So if you need
yeah,
30 grams a day, that's a third of the way there.
yeah.
Hmm.
So very interesting. Any other? So let's see. We've only got a couple minutes here, but I want to make sure. Give us your take on your Altman team and why patients should consider choosing you and your team to make sure they take care of their colon health.
Altman just feels like home. A lot of the patients don't necessarily want to drive far to go to other hospitals up north because, again, they have transportation issues and they really just want to stay home, make it easier for their families to visit them. Our team is lovely. I love everybody on my team in the office, my nurse practitioners, people I work with in the operating room, the nurses on the floor. If you have a concern, everyone's willing to help you out. Everyone is just so kind and so nice to all of our patients. I think we have great technologies. We've talked about previously. We have 3 robots at the main hospital that we utilize to get better patient outcomes. We have a brand new cancer center. So our medical oncology team, the chemotherapy doctors, essentially, and our radiation oncology team are located there. So patients are able to get all of their care at one location. And then as far as me, I am very easy to talk to. My door is always open, and I have a pretty good turnaround. So from the time a patient sees me in the office, they can usually get their surgery scheduled within 2 or 3 weeks. I had a patient one time, I saw her on Friday, and I had her scheduled for Monday. So I'm really willing to work with patients. I take all of my cancer patient cases very seriously, and my scheduler and I work closely together. So if a patient has to wait longer, I always tell her that's not good enough and we have to figure things out. So whether that's moving things around my schedule or trying to figure out where we can find, free time in the operating room, that's what we do to try and take care of patients, because patients, as soon as they get that cancer diagnosis, they want it done today. And so we work really hard to try and get people taken care of quickly.
So, question for you, and probably from the listeners too. So, you mentioned some of the high risk things you should be looking for symptom wise, like weight loss and unexplained diarrhea, blood in the stool, to name a few. If you experience that, what should a patient do? Should they call your team directly? Should they call their primary care first? What's the chain of command to get someone care quickly?
Most of my patients can just schedule directly. I think some insurance companies require referral, and off the top of my head, I don't know that, but they can either call my office and try and be scheduled as soon as possible, or reach out to their primary care doctor. And the primary care doctors, they all kind of know how to reach me to say, hey, I have this patient I need you to see urgently. And we're really good about squeezing people in. The cancer stuff, I'm very good about getting people in as quickly as possible and kind of double booking a time or things like that to get people seen quicker.
I want to give a plug to in the pharmacy. We often hear people come in that don't have a primary care doctor. So it's very important that you have a primary care doctor that knows you and your situation. So I'm quite sure Altman has resources for you if you don't have a primary care doctor, and you can call them or reach out on their website and they can help direct you to providers that are taking patients. But anything else you'd like to summarize for our listeners today to give them a good overview of how important colorectal screening is and Colon Cancer Awareness Month is?
Never ignore bleeding. It might be something that is just hemorrhoids, but it could be something worse. Don't ignore changes in bowel habits. If you have a known family history, please get evaluated. And a colonoscopy is not as bad as you might think. I actually have lots of patients that say afterwards, this actually wasn't that bad, or, oh, we're done. And I promise a colonoscopy is a much easier, swifter recovery than having to undergo a major operation that in itself can have complications or other things that can happen just from being down and having to be in the hospital for a certain amount of time. So I can't emphasize enough how important and how passionate I am about this. And if you have any questions or have trouble being seen, I'm very available. If people want to talk about colonoscopy and what that entails, I'm more than happy to talk about them with them in my office. If they're not sure if they need one, we can talk about that. So I'm always available as a resource. People don't always necessarily have to go to their primary care doctors. They can always come to my office and we can talk about it as well.
Okay. Thank you to our guest, Dr. Labrie. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health System and our listeners joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC. Thank you very much, Doctor.